Hello, my name is Jane Pildich and I will be your host for this webinar series. This is the first webinar in a series for the Inborn Errors of Metabolism Stakeholder Network, and I'm going to explain what all of that is as we proceed. But first I wanted to tell you a little bit about myself. Like I said, my name is Jane Pildich and I am the lead patient partner on this project. I work at the Michigan Public Health Institute, which is MPHI, and we have the grant for this project. I'm the senior project coordinator, and in that role, I work on a number of state and federal projects, most of which are involved working with populations with special health care needs. I have a master's in public administration, but my most important qualification for this job, I think, is that I'm the parent of a child with special health care needs. My son Michael was born with a metabolic condition, an inborn error of metabolism. It was undefined. We never got an exact diagnosis for what he specifically had. And in the early years, he was extremely medically fragile, and we were uncertain what his future was going to look like. I'm happy to say he's now 26 years old. He's living in a house with 5 other men with developmental disabilities, and he's doing very well. And that's not to say we don't have challenges, because we do, but his health is stable, he's happy, and he has far exceeded anyone's expectations for him that they had when he was born. And so this is the reason that I'm so passionate about this work. And later in the webinar, we're going to talk about our why. And this is really my why, and the reason that I enjoy working with families so much. Even though diagnoses and situations can be very different, we're in a similar journey in many, many ways. And so this is what makes this work really rewarding for me. So enough about me. And now I'd like to tell you a little bit about this webinar series. This is a series of training videos that was developed for the IBEMCSN, and that stands for the Inborn Errors of Metabolism Collaborative Stakeholder Network. And this is a grant that's been funded through PCORI, the Patient-Centered Outcomes Research Initiative, and I will get to discussing the organizations and what all those acronyms stand for. But basically, the webinars were designed to be interactive and a training tool for our stakeholders. Since using them on a couple of projects with stakeholders, we decided to post them on our website as a resource, but we didn't really want to post the live webinars because we had, patient partners and clinicians participating. We just weren't comfortable using people's names, and a lot of them shared personal information. And so we are retaping these just as a resource for the website. So some of the sections that are designed to be discussions, I will basically just tell you about what we do and how we do it. But I think that they're still valuable as far as a training tool that other projects can look to and use. So the original series was 6 webinars in length. We combined them, so we have combined them into 4. And so that's what we will be doing, is taping each one individually. You can look at them at your leisure. You can, they're intended to go in order, but you certainly don't have to watch them all in order. We always start our webinars with an outline, just so people know what the plan for it is, and also helps to keep me on track. So in this first webinar, we're going to, of course, have a welcome introduction to the webinar series, introduce you to the team that works on this project. We'll talk about who's on first, what some of the different organizations are, and how they're interrelated. And then we're going to talk about research done differently, patient engagement, and talk about starting with the why. The objectives is something we always go through at all of our webinars. This is what we hope that you will get out of listening to this webinar. We're going to learn about the webinar series, meet the team, understand what MPHI, IBEMC, PCORI, and Quest are and how they're all related, discuss the importance of patient engagement, and help you to understand what your why is. So this is the team on this project, and we we all have worked together for a while in different projects related to genetics and different healthcare needs, and this smaller group has come together for the IBEMCSN project. So Matt up there in the corner is our senior research scientist and the PI. He provides the overall direction for the project. He's also the parent of a child with special healthcare needs. That's his son Elijah in the picture. Cindy Cameron is our director. She is a public health specialist. She's worked in the field for years. She shares her expertise and insight with us as a consultant. There I am again with my son Michael. Nancy Leslie is a geneticist at Cincinnati Children's Hospital, and she is lending her expertise to us on our Quest project, which I'll explain later. And then Dr. Sue Berry is a geneticist at the University of Minnesota. She's been very involved with MPHI and the IBEMC for years on a variety of projects, and we're really lucky to have both of those clinicians working with us on this. So before we start, I'd like to just say a little word about acronyms. We use a lot of acronyms in this field. As in any field, if you're not familiar with it, it can be confusing, and we always encourage our stakeholders to ask questions and ask what things are. I know that I don't always know what some of the languages in the genetics field, but we will do our best to decipher these for you and try to keep our presentations family friendly. So in that, the spirit of that, I'm going to start with kind of explaining who's who and what's what, who's on first, so to speak. MPHI, like I said, it stands for the Michigan Public Health Institute, and that's the organization that Cindy, Matt, and I all work for. And we're a nonprofit public health institute, and we work very closely with the state health department in Michigan, and also we have several federal projects, one of which is the Midwest Genetics Network, and that's that next one down there on the left. We sometimes refer to as MGN, and this is a regional genetic network funded by the federal government. There are 7 across the country, and we represent 7 states, and the goal of them is to improve access to genetic services for individuals and their families, people that might have conditions identified at newborn screening or other inherited conditions. And these are funded by HERSA, which is the Health Services Resource Administration. That's an agency within the U.S. Department of Health and Human Services, and HERSA is the one that funds these genetic collaboratives. PCORI stands for the Patient-Centered Outcomes Research Institute, and we just refer to it as PCORI. And PCORI is the agency that funded the IBEMCSN Engagement Awards. We'll talk a lot about PCORI and the principles and why we're so excited to work with them. And then the IBEMC is the Inborn Heirs of Metabolism Collaborative, and that was kind of the founding project that started the rest of these off. So here's just a little flow chart so you can see a little better. We have HERSA up there, which is again the federal government. It funds MPHI where I work. We have the grant for the Midwest Genetics Network through HERSA, and one of the projects that came out of that MGN grant is the IBEMC. So the IBEMC is a network of over 30 metabolic specialty centers across 21 states. And the goal of the IBEMC is to understand how inborn errors of metabolism work in order to provide the best possible care for patients. So because inborn errors of metabolism are so rare, there's not a lot of research data or knowledge out there. Patients are typically treated depending on where their geneticist went to school and who they studied under. There's not a lot of standard of care for some of these conditions. So a lot of these clinicians have joined together and they've created this database, and they have 2,100 patients enrolled over. We have over 700,000 data points collected at this point. And the reason behind this is really so that they can collect information about these patients and find out more about the conditions that they have and how they progress long term, so that they can understand them better and ultimately provide better care for the patients. The one thing that's missing from the IBEMC is that there's no patient input. Patients were never asked any questions about the condition, how they feel, experiences that they've had. It's all really clinician driven. So that's where we come in to talk about PCORI. And again, it stands for the Patient-Centered Outcomes Research Institute. And it ties into the whole idea that patients haven't been included in research or, working with doctors to try to figure out treatments or cures for diseases. And as such, traditional medicine hasn't always been able to answer the questions that patients and their families and their clinicians face daily. Reliable information isn't always available to the patients. And it's not always, if it is available, it's not always available in ways that they can understand or use effectively. So PCORI was established to help address some of these challenges. What comes to mind when you hear patient-centered outcomes research? I mean, I think the typical paradigm for medical research is the researcher on the left there, that we have the medical profession, they know best, they'll tell us what we need to know, and we've always kind of revered them in that role, that they know everything and we go to them to get the answers. Patient-centered outcome research is different. It's a collaboration between the patient and the medical community, and working together, helping to decide what's right for individual patients and how we can best work to help them. So it's really a way of doing research differently. PCORI only funds patient-centered outcomes research, and these are this is research that the topics, the question, the outcomes are most important to the patients and those who care for them. And you might have heard the slogan, "Nothing about us without us." Different organizations have used it over time, but it's really better research through patient engagement. So given my personal characteristics, conditions, and preferences, what should I expect will happen to me? What are my options, and what are the potential benefits and harms of those options? What can I do to improve the outcomes that are most important to me? And how can clinicians and the care delivery systems they work in help me to make the best decisions about my health and my health care? So it's really, I mean, it sounds like a great idea. We kind of think, why didn't we think of this before? But it's really asking the right questions with the right people at the right time. And this is really the foundation of PCORI. So the PCORI Engagement Awards are a specific stream of funding that PCORI has. And the Engagement Awards are designed to help you build up the infrastructure to allow patients to have more of a role in research. So before you're able to actually, start writing research proposals and be involved in research and help disseminate results, you have to build those relationships and build that foundation. And that's what the Engagement Awards try to do. And they, one way to describe them that I kind of like is pipeline to proposal. It's really what you need to do to get to the point where you're able to submit a proposal and get funding for research that's important to patients. So these grants allow us to bring people together who might otherwise not be working together. The IBEMCSN, which is the Inborn Areas of Metabolism Collaborative Stakeholder Network, and I will now only refer to it as IBEMCSN, is made up of patient partners. We have providers like geneticists, nutritionists, dietitians, genetic counselors, nurses, public health professionals. We have the project staff here at MPHI. And so the Stakeholder Network is really bringing all those people together so that we can work together as equal partners in a team. So what do we mean when we talk about patient-centered patient engagement in research? Engagement is the meaningful involvement of patients, caregivers, clinicians, and other relevant stakeholders. And this means engagement throughout the research process, from planning the topic, from planning what the question is that people want asked, from planning how the research will be designed, study methodology, conducting the actual resource, and then disseminating the research. So it's really involving patient partners and other stakeholders throughout the entire process. Why do researchers care about involving patients? I mean, this is really a shift in paradigm from the medical profession, doing it all and knowing it all. And I'm going to read this quote that I really like from PCORI. It's from their website, and they have quite a few resources on their website, and I'll provide you with the link at the end of the webinar, but I would encourage you to look at them. Engagement helps ensure that the research we fund provides information that patients, their caregivers, and the broader healthcare community need to inform the decisions they face daily. It brings insight and experience often missing in traditional research. This makes it more likely that researchers will study the right questions and that results will be patient-centered, trustworthy, relevant, and taken up in practice. Why do patients, what do they bring to the table? Why do we want them to be involved? Patients, and if you're watching this webinar, you most likely might be a patient partner, and I think you can relate to some of this. Patients bring passion to healthcare questions and treatment options. And it's not to say that clinicians and other providers don't, because I think most certainly they do. I think they were drawn to this field for a reason, and many of them are very passionate. But it's a different kind of passion when it's your health, when it's your life or the life of someone you love. It's different, it's emotional, it's personal. And so I think patients really bring that drive to the table to want to know answers and to help people. Patients bring expertise. If you're living with a condition 24/7 or you're caring for someone that does, no one else can possibly understand what that's like. I remember going to the doctors with my son, and they'd tell me to go home and say, you have to do X, Y, and Z, and I'd think they would not tell me to do it, and they would not tell me to do it like this if they had to do it. They don't realize how hard it is day to day to actually do some of this. They don't understand what it's really like, what the effects of medications might be, how hard it is to stick to maybe a very strict dietary regimen. Patients are really the ones that have that knowledge of what it's like to live with the condition. Perspective is something we'll talk quite a bit more about, but patients and caregivers often have a very different perspective than providers. Different perspective of what's important to them, what they want to know, and perspectives are also very different for each patient partner. We all just don't have the same values and ideas about what we want to get out of a situation. So the perspective that patients bring to research really helps broaden what we're looking at and what we're talking about, and makes it more relevant. Credibility. When we get to the part of research, one of the biggest parts of research is disseminating the information and the knowledge that's been gained from a study. And knowing that patient partners and people that actually live with the conditions have been involved really brings a lot of credibility to that information and to those results. I know that I've always felt that the best information I've ever received regarding services or lots of information about things I needed to know for my son came from other parents, and I'm much more likely to trust them if I know it's somebody who's kind of walked the same path as me. So all of these, passion, expertise, perspective, and credibility, are really some important resources that patients bring to the table. Why do patients want to be involved? I mean, especially if you live with a special healthcare need or you're taking care of someone. I mean, our days are crazy busy, stressful. Why would a patient want to be involved in a research project? And these are just some of the ideas that I've come up with that mean something to me and what I've heard other people say. When we do these webinars with our patient partners live, we can get into a good discussion, and we hear a lot of different reasons. These are some of the most common. People want to make a difference. We want to be able to give back. We need answers. I, for example, still don't know a lot of things about my son's health and why he was so ill and what was going on and will it reoccur. And, we want answers. I want to help others. I hate to think that someone else is going through what we went through, and maybe we can help the next person in line. Want to advance science. Genetics is still really kind of a a baby, and as far as a specialty, it's advanced greatly, and it advances at, very quickly, but we still know so little about genetics and how diseases work, and particularly the really rare ones like inborn errors of metabolism. And I want to learn more about my disease or condition, or the condition of the person I love, to be able to help them better and help them have a better quality of life. So now we're going to talk a little bit about starting with the why. And the why, I mentioned before, this is something we do with our stakeholders. I like to do this exercise in a group with people, and we do it in pairs, and it's very powerful. I had done it at a training I went to. I'm working on another project that I do, and it was really one of the most powerful exercises that I've ever done with a group. And so when we do it with our stakeholders, we've done it over webinar, and it's a little different. It's not as impactful, but I think it's something that you can still get something out of doing it on your own. One of the things that we talk about in the other project that I work on is that some people are really good at being leaders or advocates. They're very powerful. They're very effective at what they do. And one of the characteristics that most, if not all, effective advocates share is that when they're addressing issues or tackling a problem, they start with the why. And what that really means is that they're in touch with themselves or their inner purpose, the values that are important to them. It's really the reason they get out of the bed in the morning. And if you have time, I would recommend that you watch a YouTube video by Simon Sinek. It's called Starting with the Why, and this is where this idea came from, because it's really powerful to think about in terms of the work you do, whether it be paid or volunteer, and kind of why you do what you do. So in the video, Simon Sinek talks about the golden circle. And most people can tell you what they do or how they do what they do, but not everyone can tell you why they do what they do. For example, if I introduce myself to someone new, I might say that I work at MPHI and I'm a project coordinator. And one of the projects I work on is the Inborn Errors of Metabolism Stakeholder Network. And I might even say that I'm drawn to this work because I have a child with special health care needs. That's typically what people say. We tell people what we do or how we do it. And our why might be, some people get to the why and it might be like, well, I like to work with people, or I want to help other people. But this is really the tip of the iceberg. There's so much more about why I work where I do, why I'm doing what I'm doing, and quite honestly, the reason I get out of bed in the morning. Much of my motivation and purpose, the values that drive my actions, are things that most people never see. And I think that's true for most of us. When you go about your day, what you put out there, what other people see about you, is just a small piece of you and a small piece of what might be going on in your life. So this is an exercise, again, like I said, we do with stakeholders, and I think you can do it on your own. You can just take a few minutes to get out a piece of paper and try to walk through this on your own. So I'm going to tell you how it works, and I hope that you'll give it a try. And usually, again, we've done this in pairs, but I think it's still worthwhile if you don't have anyone else to do it with. So we tell people to get out a piece of paper and start with the question, I do what I do because, and then you answer that. I do what I do because I want to work with kids who have disabilities or something. And then you ask why. And then you answer that because, and then you ask why again. And you do this 9 times. And I'm going to do it for you in my situation so that you can see how it's done. I do what I do because I have a child with special health care needs. Why? Because I want to help other families who have a child with special health care needs. Why? Because I don't want other people to have to go through what my family went through. Why? Because we had no one to help us navigate the path we were on, and there was no one to give us answers. Why? Because no one knew what we were dealing with, and it was a very isolating and lonely place to be. Why? Because the doctor had never seen a child like ours before. Why? Because no one could tell us what our future would look like or if our child is even going to have one. Why? because we had no one to talk to share our experiences with us, to help guide us. Why? It was so isolating and painful. Why? Because it's just too painful to think that we went through this for nothing. So as you can see, when I really dig down and deeper the why I do and continually ask myself, I discovered that I do what I do because it comes from a place of pain. It was a situation that I really couldn't control, and it helped me make some sense of it, I think, by thinking I could help others or make it a little better for my son or for anyone else going through a similar situation. And so, I encourage you to do that exercise on your own. Take some time and see if you discover anything new about yourself. It's very powerful to be able to identify what drives us and to be intentional about this in our everyday work. You think about if you wrote this down on a slip of paper and kept it on your desk or in your wallet or in your purse and reminded yourself of this every day. And I think of that sometimes when I go to work and I might be working on a project and be, a little burnout or bored or not as interested some days as others. And I think about, why do I really do this? I'm really doing this because of my son and what we went through and the terrible time that we had when he was so ill. And when I think about that I have the opportunity to maybe make a bit of a difference in making it better for him or other people, it gives me a real sense of purpose. And so again, I would encourage you to maybe do that and think about why you want to be involved in a project like this and why it's important that we have people with such passion involved in our project. Our stories are powerful, so we shouldn't be afraid to share our stories. People will remember your story long after they remember your name. We find that in different groups we get together, people's parents start sharing experiences they've had, and those are the things that really stick with us, and they create a bond. And when you look at the history of newborn screening and some of these really rare disorders, it's really been the power of families and their stories that have shaped the program into what they are today and helped advance some of the work. And we'll talk more about advocacy and the leadership roles that patient partners can take in subsequent webinars. So again, here's our the slogan again, nothing about us without us, and you'll see this frequently. We like to use this one. I think it's very meaningful. The key point of this project in this webinar is really nothing about us without us. We value the passion, the expertise of patients and their caregivers, and that's what makes this project so different and the work of PCORI so different. So we are happy that you're taking time to watch this. We look forward to working with you. I have put some resources up here for you to look at. The PCORI website is a wealth of information. They have all kinds of things about patient engagement, what it means, how to engage patients, both for providers and patient partners. And then I also put the link up to the Simon Sinek webinar. So I hope that you'll take a look at those. My contact information is on the back of the back slide here, and please feel free to contact me if you have questions about our projects or our webinars or anything else. And I would just like to thank you for joining us today.